Intravenous medications go directly into the bloodstream. PO is a Latin abbreviation for by mouth. IM stands for intramuscular, meaning into the muscle. We'll take the drug and we'll inject it into the muscle. The drug will remain in the muscle and then diffuse out into the blood. That's what depot is, a storage place. So intramuscular medications can have 100% bioavailability, and we will inject them into the muscle and basically have a sustained release. Something that you need to understand is intramuscular injections have a very inconsistent delivery of medication. However, it's very convenient, at least for the person giving the medication, to inject it to the muscle. Not so convenient for the recipients. SC stands for subcutaneously. Sometimes you'll see it abbreviated SQ. That's kind of cute to use Q to stand for cutaneous. However, SC is the term to describe subcutaneously. And that means right under the skin. Right under the skin is this fat pad. When the drug is injected subcutaneously, it stays in this fat pad and then is released out of that subcutaneous fat pad and into the blood. Insulin is usually given subcutaneously, where it can stay in that fat depot and be released to the blood. PR means by rectum. Many drugs that are used as anti-nausea and anti-emetic drugs are given PR. And with PR medications, bi-rectum medications, still those drugs can undergo the first pass effect, but less so. Inhalation means going directly to the lungs, and then it can get into the bloodstream after that. So with asthma medications, we can use the inhalation route to go directly to the lungs, giving us maximum tissue bioavailability. However, some drugs can be inhaled with their intention of entering the systemic blood supply. So some systemic drugs can be inhaled. Please do not confuse transdermal with topical. Transdermal means it's applied to the skin. Our intention is for the drug to cross the skin and enter systemic blood supply and treat an area other than the skin or mucosa. When we use a topical medication that's applied to the skin or mucosa, then our action is intended locally at that site of administration. Intranasal means that it is put into our nasal mucosa, and from the nasal mucosa, it can either treat the nasal mucosa or enter the blood supply and be used systemically. So some drugs that we'll use intranasally will be used locally at the site of administration. Other drugs can be used intranasally to be absorbed systemically for other areas of the body. Something to keep in mind is this area of the face drains directly into the base of the brain. That's why they call this the danger triangle. Intrathecal means into the cerebrospinal fluid. When a child has acute lymphoblastic leukemia, we need to give that child methotrexate to treat the leukemia in the brain. However, the methotrexate will not cross the blood-brain barrier, so the methotrexate has to be injected into the cerebrospinal fluid to treat the brain for the acute lymphoblastic leukemia. Epi outside of dura, the dura mater, the spinal dura. So epidural means outside of the spinal dura and is an anesthetic technique. Intra-articular means into the joint space. Sometimes we will inject steroids or glucocorticoids into the knee or other joint space to decrease inflammation. So when we inject something directly into the joint space, that is intra-articular.